Hi, Candace.
Hi, good morning, doctor. How are you?
I'm fine.
You know, can you tell us what is systemic lupus?
Lupus is a disorder of the immune system. Our immune systems are there to protect us from outside invaders like viruses and bacteria and bad things in the food that we eat. But in lupus, the immune system has gotten imbalanced and it ends up causing inflammation in various organs of the body. The commonest things that you see are arthritis in the joints or skin rashes that can be quite severe at times. But sometimes patients just get fevers and achiness, fatigue, loss of appetite, and then almost any organ in the body can be damaged by this: the heart, the lungs, the kidneys, the brain. It's mostly seen in women of childbearing age, although men can also develop lupus, and so can children. So it's very unpredictable. It can be very hard to diagnose because, as you can imagine from what I just told you, it can mimic many other diseases, and it's very hard to manage. It really requires an expert rheumatologist.
And can you tell us about the National Burden of Lupus survey that was released?
Yes, well, this was a survey that wanted to put a face on lupus and really understand what's going on with the patients. But actually, the results cause a greater concern than just understanding people better. It turns out that most lupus patients reported that they are minimizing their symptoms, both to their families and friends and to their doctors. What this can mean is that they may not be getting optimal treatment, and over time, that can lead to disability or even death.
And why do you think that those surveys were minimizing their symptoms when talking to their doctors?
Well, of course, I don't know, but I'm guessing that it's sort of human nature to not want to be a complainer. And remember, these are young people usually, and they want to live their lives. They want to have fun. They want to be normal. And they don't want to be complainers. They don't want to be a burden to their family. They may even be worried that they'll hurt their relationships if they complain too much. And somehow that's carrying over into the doctor's office as well.
What advice do you have for those looking to talk to their doctors about symptoms they're experiencing?
Well, I think this is a three-way problem. So I can give advice to patients, I can give advice to doctors, and I can give advice to families. And I think I'll start with the doctors so I can give myself some advice. And that advice is that doctors need to listen more. I know sometimes I'm in a busy clinic and people are pulling on my arm and telling me I'm backed up, there are too many patients waiting, and they're all getting mad, and I'm getting phone calls and I'm getting emergencies, and I can walk out of a room kind of suspecting that we haven't completed the conversation. I need to be more sensitive to that because it could really lead to long-term damage down the road. Similarly, the survey showed that people at home who don't always have such close relationships with the doctors, patients sort of in between these two sets of people, they're not so convinced that the patients are really communicating effectively with the doctors. In fact, they seem to be less convinced than the patients are. Similarly, the doctors are not so convinced that the people at home are giving full support. So we've got this huge breakdown in this three-way kind of triangulation of people that are involved in the well-being of this lupus patient. And I think we need to cross over those barriers and get this thing going. From the patient's point of view, they need to know that it's not a burden to a doctor to be told all your symptoms, because that's what the doctor's there for. We get paid to do this, and beyond that, we're going to feel better if we're going to render optimal care, and we can be confident that we're doing that. From the point of view of your family, I think the same thing is true. If you don't tell your family what's going on, there's an unease because there's much left unsaid. I think that if you can level with your family, but somehow do it in a way so that they can feel they can be helpful to you, then they're going to like that. That's going to be good for the relationship, not bad. You're not a whiner. You're a person who's trying to come to a solution, and you're asking for help, and you're thanking people for it. From the point of view of the family, I think they need to kind of understand that we go through our daily lives and we don't always tell people why they're valuable to us. And it may be that people with a chronic disease really need to hear all the ways that they're valuable irregardless of that disease. And that might make them more able to kind of be a little more negative and say what's really going on.
And how is lupus typically treated?
Well, there are many treatments for lupus. There's been an evolution over the last 50 years, in fact. But at this point, it's all kind of individualized, so it depends from patient to patient how you would approach the treatment. But again, this survey is really talking about a very important aspect of treatment, which is the communication issues. And it's throwing to light an awful lot of other things as well. For example, men with lupus are often kind of not thought about very much because 9 out of 10 lupus patients are women. But men can have serious lupus, and it turns out the survey suggests that they have a lot more problems with their marriages. Twice as many men as women seem to end marriages or their significant relationships because of lupus. And they also seem to be filling out answers to questions about self-esteem, showing that they're getting a big impact on their self-esteem from the disease, more than women.
And do you have any additional information you'd like to share?
Yes. There's a website, usinlupus.com, that people can go to. Patients can actually download something called the Lupus Impact Tracker, and it can help them kind of organize their symptoms and maybe make more efficient use of the limited time that they might have in a doctor's office to communicate. But also there's lots of information about all the aspects of lupus. Plus there's a website, lupus.org, from the Lupus Foundation of America, which provides many services.
Well, thank you so much, Doctor. I truly appreciate it.
Thank you for helping us to get the